Hello everybody. In this video, I am going to explain vascular calcification. How it is important, why the vascular calcification affecting the patient's lifelong. It's a chronic disease and once it's developed, it's difficult to treat medically or by device. So let us dive into this. Vascular calcification is not just calcium settling passively in blood vessels. It is an active, cell driven biological process, very similar to bone formation happening in the wrong place. Let us understand how this happens at the molecular levels, step by step. Step 1, injury and stress to the vascular wall. The process starts with a chronic injury to the blood vessels. It may be due to diabetes, high blood pressure, high cholesterol, smoking, chronic kidney injury, and aging inflammation. This injury damages endothelial cells, endothelial layers. Step number 2, endothelial dysfunction and inflammation. Once the endothelium is damaged, nitric oxide production will come down in the vasculature. Protective anti-calcification signals will come down in the vascular wall. Inflammatory cytokines will go up. Key inflammatory mediators are involved in this process, particularly tumor necrosis factor alpha, interleukin 6, interleukin 1 beta. These molecules signal deeper layers of the artery to change their behavior. Step number 3, phenotypic switch of vascular smooth muscle cells. This is the most important molecular step. Normally, vascular smooth muscle cells maintain vascular tone and elasticity. Under stress condition, vascular smooth muscle cells lost their contractile phenotype. They transform into bone-forming cells, like osteoblast-like cells. This process is called osteogenic differentiation of vascular smooth muscle cells. Step number 4, activation of bone-related genes. Once the vascular smooth muscle cells transform, they start expressing bone-related proteins such as RUNX2, master bone transcription factor, osteocalcin, osteopontin, alkaline phosphatase, bone morphogenetic proteins, BMP2 and BMP4. These proteins do not belong to arteries, but they now behave like bone tissue inside the arteries once a calcification is developed. Step number 5, calcium phosphate crystal formation. At the same time, blood calcium level will go up. Blood phosphate level also will go up in kidney disease. This leads to formation of hydroxyapatite crystals, the same mineral found in the bones and teeth. These crystals deposit in coronary arteries, aorta, heart valves, peripheral vessels, kidney, and brain vessels. Step number 6, loss of natural calcification inhibitors. Healthy arteries have natural protective molecules that prevent calcification. They inhibit, the key inhibitors include matrix GLA protein, MGP, phetin A, pyrophosphate. In disease states, these inhibitors are reduced or inactive. Vitamin K deficiency worsens this process. Calcification becomes uncontrolled. Step number 7, role of oxidative stress. High oxidative stress causes excessive reactive oxygen species, DNA and protein damage, further activation of calcification genes. Oxidative stress accelerates vascular smooth muscle cell transformation, calcium crystal growth, plaque instability. Step number 8, apoptosis and calcification nuclei. As vascular cells die in apoptosis, they release membrane fragments. These act as seeds for calcium deposition. This explains why advanced plaques show heavy calcification. Older plaques are harder and more rigid. It is difficult to treat medically. In simple terms, vascular calcification means vessel injury occurs. Inflammation increases. Smooth muscle cells turns into bone-like cells. Bone proteins are produced. Calcium phosphate crystals form. Natural inhibitors fail. Oxidative stress worsens everything. As a result, artery slowly turns into bone-like structure. Why this is dangerous clinically? Molecular calcification causes loss of arterial elasticity, high systolic blood pressure, reduced coronary blood flow, plaque rupture, and heart attack, stroke and kidney damage. You can think, can molecular calcification be stopped? Is it possible completely? But complete reversal is difficult. But progression can be slowed by controlling diabetes and blood pressure, managing phosphate levels in kidney disease, statins and anti inflammatory strategies, adequate vitamin K intake, lifestyle modification, particularly exercise, regular exercise, controlling obesity. Vascular calcification is active in general. We must know. Genetically regulated. It is inflammatory driven. Bone biology occurs inside arteries. Understanding this molecular process helps doctors treat successfully. Patients prevent complications. Society reduce heart attack, stroke, and kidney disease. So, calcium belongs to bones and teeth only, not in arteries. Protect your blood vessels early, and your heart will thank you forever. You may think, is there any food to control or prevent calcification? Yes. Vitamin K is a good substance and effective substance can prevent calcification. Vitamin K is abundantly found in green leafy vegetables. That is the reason every cardiologist suggests their patient to take leafy vegetables once in a day, at least minimum 5 days in a week regularly. And statin drugs, regular exercise, controlling diabetes, controlling your blood pressure, systolic blood pressure, controlling your obesity, restricting your salt intake, restricting calcium intake will reduce coronary calcification, heart valvular calcification, brain vessel calcification, and peripheral vessel calcification. All the calcification can be stopped by these effective steps. So don't forget to protect your vasculature and calcium formation in your arteries, heart valves. Thank you for watching this video. We will meet in the next video. Until then, bye bye. Take care of your heart. Be safe.